Good evening, good afternoon, and good morning. This is the 1504th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Surjit Singh Makkar. Let us begin the session with 1 minute silent prayer. Thank you all. As you know, that we just celebrated the 1500 day some 3 days back, and today we are lucky to have another presentation with Dr. Surjit Singh Makkar, and he has presented a beautiful session sometimes earlier. And not only that, during the our celebration itself, Doctor has presented a beautiful case presentation here. And as you know, Doctor is very well known to us, and was the former joint director, Punjab Veterinary Homeopathy Visionary, and is integrating holistic practice with the latest advancement of artificial intelligence in digital health and imaging. He is an internationally acclaimed consultant and researcher, always here to present different aspect of uh, diseases and management, the same with the homeopathy in veterinary side. So today, Doctor will be discussing about the role of homeopathy in skin disease of pets. This is a very, very important subject. We used to get these kind of patients every day. Even the homeopathic doctors also getting such cases, and we can know very well about how to manage those issues. So we proudly welcome Dr. Surjit Singh Makkar. Welcome, Doctor. Please unmute. Please unmute, sir. Yes.
So if it is a
Yes, we get it. Everything fine, sir.
okay. Tom, now it is okay.
Okay.
Tom, visible to everybody?
Yes, visible.
Oh, that's great. That's great. So, dear friends, thank you so much to you, especially the Ifph people, my seniors, all my Dr. Dinesh and Dr. Sani and all our seniors. And thanks for all people giving me this opportunity. As you know, this is a homeopathy is going to be a medicine of future. So today my lecture is on skin conditions, how we treat the skin conditions with homeopathy. I will describe you many cases and the common conditions we are treating in veterinary science at field level. I will give you the practical examples of how we are treating the skin conditions with this homeopathy. So first of all, it is dermatitis. As you know very well, dermatitis is characterized by redness, inflammation, itching, and sometimes blistering or scaling. It may be acute or chronic, can be triggered by allergies, environmental factors, or stress. The homeopathy approach, not just the skin, but the overall imbalance in the body's health that manifests it is as dermatitis. So this is the beauty of the homeopathy. So it takes the totality of the symptoms into account. In the conventional system of medicine, we can use only the location, but in homeopathy, we are talking about LACM, that is location, etiology, concomitants, and modalities. We take all these things into account. Then we reproduce the case, and every time we take PQRSU symptoms into account. That is peculiar, cure, rare, uncommon symptoms into account. And that all then by taking the totality of these symptoms, we find the simillimum. So this is how we take the veterinary case. So by taking the case, we decide which remedy is going to be factored. So these are some of the key remedies which are helpful in the graphites. Graphite is a very good animal that's often used in animals, suitable for animals with thick, rough, and dry skin, often with cracks. The eruptions are typically moist and ooze honey-like sticky fluid. This is the beauty of the these graphites. Whenever it oozes a honey-like or sticky fluid, so that indicates the use of the graphites in that case. So we are using it. So this is constitutional file. Patients, they are often chilly, obese, and have a tendency towards skin infections such as eczema or psoriasis. So modalities: worse from cold and washing, better from warmth. So this is how we take into account all the things. That is LACM: location, etiology, concomitant, and modality. By all taking all these things into account, we take the case, and of course we take the mind symptoms into account also. Mind symptoms are very important for case taking in animals, and in animals we got very good symptoms because the animals always behave naturally. They don't hide anything from us. Whatever they are showing us. But the need is only observation. How you observe an animal, that is main thing you can do. A doctor can, that is main thing. Otherwise, the animal expresses its all symptoms very nicely. If one is keen observer, he will observe every and each minute symptom. So this is a case example. A 7-year-old obese Labrador was presented with chronic eczema on the elbows and in skin folds behind the ears. The skin was thickened, dry, and cracked with occasional oozing of a sticky honey-like fluid. The dog was generally sluggish, preferring to lie down in warm places. After prescribing graphites, improvement was observed within 2 weeks. The cracks healed and the oozing reduced. Over 2 months, the dog's skin normalized with no reoccurrence of eczema. So this is how homeopathy works wonders. Second medicine is sulfur in dermatitis, used for intense itching, burning skin conditions. The skin is dry, scaly, and often dirty looking, with a tendency to become red and inflamed after scratching. This is a very good point. Tendency to become red and inflamed after scratching. This remedy is often chosen for animals that exhibit a strong desire for warmth and dislikes bathing. So this is how we describe the portrait of the remedy. Every time we remember the portrait of the remedy. So constitutional profile is these sulfur patients, they are always hot-blooded, restlessness, and crave for sweets. This is the beauty of these sulfur patients. Modalities: worse from heat, water, bathing, and at night. Better from cool and fresh air, because it is a hot animal. So this is how we take the case, and we take the remedy into account, and we prescribe the remedy. Skin symptoms: they are dry, scaly eruptions with intense itching and scratching, often result in bleeding and worsening of the condition. Okay, so this is a case example. A 5-year-old Persian cat now had recurrent dermatitis with constant itching and scratching, leads to scabs and hair loss, particularly on the back and head. The itching worsened at night and after being bathed. The cat was showed a desire for warmth and often slept near heat sources. Note this point: desire for warmth and often slept near heat sources. That's why we have given sulfur, was administered, and within 3 weeks, the cat's itching reduced significantly and new hair growth was observed over the course of treatment. The skin lesions heal completely with no further reoccurrence of the condition. Miserium, one of the very good medicines, one of the remedy of choice, you can say like that. Sometimes best for cases where the skin condition is marked by thick crusts over eruptions. This is the portrait of the remedy, that it is marked by thick crusts over eruptions with constant itching and burning. There may also be a fluid discharge under the crusts, which hardens and forms scabs. This remedy is often suited for conditions aggravated by cold air. So constitutional profile is typically nervous, chilly animals, sensitive to drafts and prone to skin conditions where eruptions from forms thick crusts. Modalities: worse from cold air, touch, and at night, better from warmth. And skin symptoms are thick crusts over vesicular eruptions with pus underneath. Yes, this is very, very important. Whenever there is a crust over the vesicular eruptions, there is a pus underneath. The animal may constantly scratch, causing bleeding also. So this is a case example of a 4-year-old border collie was diagnosed with chronic dermatitis characterized by thick, scaly patches and crusts around the ears and neck. This condition worsened in cold weather, and the dog constantly scratched, leading to secondary infections. So we have administered over here this 30C Mesarium, and within a few weeks, the crust started softening and the itching reduced. Over 2 months, the skin completely healed and the scab disappeared. So over here, dear friends, I want to mention also, if you say we give the medicine and the next day miracle will happen, no, it is not done like that. We have to find every time we have to take the case, because homeopathy is an individualistic medicine. Every case we have to take as an individual case. Then we have to take reproduce the case. Then we have to take the totality of the symptoms into account, and we have to find the minimum. And after the finding the LACM, we can proceed forward, and then we can give that medicine. Okay, then we can, you can say, get very, very good results from homeopathy. And if you start giving to any animal like sulfur and mesarium and graphites without knowing anything, without doing anything, without reading anything, so we have to ultimately read every and each word and every line of the materia medica and of that remedy. Otherwise, you can say we can't go through these cases. Okay, so the next medicine is sorinum. This remedy is used for animals with severe stubborn and recurrent skin eruptions, especially in those with a history of suppressed skin complaints or who are prone to recurrent infections. It is also indicated when skin conditions improve in summer and worsen in winter. Note this point. Skin conditions improve in summer and worsen in winter. So this is the constitutional profile. Sorinum patients are usually chilly with a tendency towards despair and pessimism. They tend to catch infections easily and have low vitality. As you know, dear friends, very well, sulfur is opposite to sorinum. In sorinum, it is a chilly patient, and sulfur is a hot patient. So these things we have to take into account every time. Every time we take the case, we have to know the portrait of the remedy we are going to use. Okay. So modalities are worse in cold weather at night and from dampness, better for warmth. So these are skin symptoms. They are dirty, foul-smelling skin with greasy eruptions, and they are itchy and worse at night. So this is again a case example. A 6-year-old Siberian husky was presented with severe foul-smelling dermatitis. The skin was greasy and the condition worsened during the winter months. The dog's overall vitality seemed low with frequent infections and a dull coat. So we have prescribed Sorinum 200C, leading to a gradual improvement in dogs' energy levels and reduction in skin symptoms. Over 3 months, the dermatitis completely resolved and the dog regained its health. So constitutional treatment and prevention in homeopathy, long-term management of chronic conditions like dermatitis, we can use this Clicaria carb also, Lycopodium, Silicia, based on the individual's characteristics and predisposition of the animal. So beyond the immediate skin symptoms, this holistic approach not only resolves the skin issues, but also strengthens the animal's immune system to prevent further reoccurrences. So this is very, very important. And this is the ultimate beauty of the homeopathy medicines, that this approach not only resolves the skin issues, but also strengthens the animal's immune system to prevent further reoccurrence. That is very, very important, and which is lacking in the conventional system of medicine. So that is why we have to use this homeopathy. So these are some of the management tips of the owners. They have to improve their dietary improvements, hygiene, stress reduction, then environment considerations. These are the managements every owner of the animal has to do with all the things. And if you say they are not keeping the animal in a well, they are not giving the proper diet and proper, they are maintaining the proper hygiene, and the animal is stressed. So there are so many, in the coming lectures, I will let you know, there are so many issues with the animals also when they are feeling stress or they are feeling anxiety. Ultimately, they will get this skin problems. So this is how they get. This ultimately will talk in the next lectures. So again a ringworm. Again after dermatitis, this is very, very big problem in animals. This is a fungal infection. So these are circular, scaly, and itchy patches on the skin. In animals, the infection commonly occurs on the face, legs, and trunk, and is highly contagious. They are very, very contagious. So you have seen so many type of animals. Scabies is there. So in the streets, you have seen so many dogs are roaming about there, which have formed the scabies. And we have taken so many projects. In the coming slides, I will make you know how we have taken that scabies into account. So homeopathy treatment focuses on strengthening the immune system to fight off the infection naturally while addressing specific symptoms. So these are the key remedies. CPR. The remedy is particularly effective for round, dry, and itchy lesions. Note this point: round, dry, and itchy lesions. The patches often appear on the face, neck, or extremities, and the condition worsens with sweating or moisture. CPR is also indicated when the animal shows signs of irritability or emotional detachment. Very, very important. That is part of the homeopathy. Mind symptoms. So constitutional profile, CPR patients are often melancholic, indifferent to surroundings, and prone to hormonal imbalances. So this is why we have to take the constitution of the profile. Constitution of the animal we have to take every time. So modalities: worse from moisture, sweating, and heat; better from vigorous exercise and cold air. So skin symptoms, they are circular lesions that are dry, itchy, often worsening with humidity or bathing. So this is a case example: a 5-year-old border collie had multiple dry round lesions on the face and ears. The dog had a history of excessive licking and irritation in humid weather. There were signs of emotional withdrawal, and the dog was less enthusiastic about playing. After a detailed analysis, CPR 30C was prescribed. Within 2 weeks, the lesions began to dry up and itching reduced. So over 6 weeks of treatment, the lesions cleared completely and the dog regained its playful demeanor. So tellurium. This remedy is highly specific for ringworm infections, particularly when the lesions spread rapidly and form well-defined circular patches with itching and burning. Tellurium is often used when the infection is recurrent or stubborn. So constitution profile is tellurium patients are sensitive to drafts and have a tendency towards fungal infections. So whenever there is a fungal infection, tellurium we can think about, and the most indicated over here is when the lesions spread rapidly and they form well-defined circular patches. They will spread, and there's a definition, there's a defined circular patches are there. Okay, this is the beauty of the tellurium. So modalities are worse from warm, moisture and scratching, better from dry and cold environments. And skin symptoms, they are ringworm lesions with well-defined circular borders, often accompanied by itching, burning, or a foul odor. So this is a case example. A 4-year-old Siamese cat now. Siamese cat. This is a almost a Siamese very good cats. They are very costly cats. You can say like that. That is presented with large round scaly patches on the back and legs. The lesions were red and itchy, and the cat was constantly licking the affected areas. The infection had been recurring for the past 6 months. Despite conventional treatments, tellurium 200 C was prescribed. After 3 weeks, the lesion stopped spreading and the itching subsided. Over 2 months, the lesions healed completely with no recurrence reported in the following period. Sulfur. The remedy is useful for persistent fungal infections where the skin is dry, scaly, and itchy. Sulfur is also indicated when the animal's skin appears dirty or unwashed, with a tendency for scratching to cause bleeding. The itching is typically worse from heat or at night. So constitutional profile of the sulfur, they are often restlessness, warm-blooded, and prone to skin conditions that are aggravated by heat and moisture. As you know very well, if you know the portrait of the remedy, sulfur, we will come to know all these things. The constitutional profile, modalities. So modalities are worse from heat, water, and scratching, better from cool, fresh air. So these are skin symptoms. They are dry, scaly, red skin with intense itching, particularly aggravated by heat. So this is a case example again. A 6-year-old German Shepherd with chronic ringworm infection presented with dry, scaly patches on its back and neck. The lesions were intensely itchy, especially at night, and worsened after exposure to the sun or warm baths. Sulfur was administered, and after 1 month, the intensity of the itching decreased significantly, and the scaly patches began to clear. Over the next 2 months, the skin completely healed with new hair growths in the affected areas. So this is the beauty of the homeopathy. It healed from inside and it covers outside also. So next medicine is basilinum. Very good medicine. Is often used as an intercurrent remedy in fungal infections. We have used it very frequently. This is a very good medicine for the fungal skin infections in animals, especially when the infection reoccurs frequently or doesn't respond to other treatments. It is indicated in animals with a tubercle miasm, where there is a history of respiratory issues or other deep-seated chronic conditions. Constitutional profile of the basilinum, they are prone to recurrent infections, respiratory issues, and weak immune systems. Modalities, they are worse from damp, cold weather, and recurrent infections. Skin symptoms, lesions are persistent with a tendency to reoccur, especially after seemingly successful treatments. So this is an example of a 2-year-old Persian cat again with a history of recurring ringworm infections and persistent lesions on its abdomen and legs. Despite using other homeopathic remedies, the infection kept reoccurring after every few months. So this is the beauty of the homeopathy, that it covers these take into account this reoccurring also. While in other systems of medicine, there's a very few remedies, few medicines are there which take into account these reoccurrences. So in homeopathy, this is the beauty of the homeopathy, that it takes into account the reoccurrences. Why this reoccurrence is there? So basilinum is the basic medicine which is used in the reoccurrences was prescribed with because this is an intercurrent remedy to address the underlying susceptibility. So after 2 doses over a period of 1 month, the cat's lesions began to heal, and there were no other recurrences after the 6 months even. Natromure, very, very good medicine. So this is particularly suited to animals with ringworm lesion that appear dry, flaky, and worse from sun exposure. So we have to differentiate between the remedies also. So whenever there is a fungal infection, why we are giving CPR, why we are giving tellurium, why we are giving natromure, why we are giving this other medicines, bacillium type. So every time we have to differentiate between the medicines also. Why this medicine over here? Every time we have to find why, what, when, why we are doing this thing, why we are giving this medicine. So when we learn all these things, we can improve our practice also. So so natromure is often indicated when the infections worsen in hot, humid weather, and when there is emotional stress. Note this point. So natromure is very, very good medicine. Whenever there is a problem with the emotional stress or grief underlying the condition. As I have treated so many animals which have this situation, when there is emotional stress or grief underlying the condition, we have to give this natromure. Okay, so constitutional profile of the natromure, they are often reserved, emotionally sensitive, and they may have a history of grief or emotional trauma. So every time while we take the history taking in animals is very, very important. And who helped in the history taking? Owner of the animals is also helps. Okay, and the other members of the family, they also help us in history taking. History taking is very, very important in veterinary case taking. So this is a constitutional profile, and modalities, they are worse from sun, heat, and emotional upset, better from cold and dry air. Skin symptoms are dry, flaky, and itchy skin with lesions that tend to worsen in hot and humid weather. So this is a case example: a 3-year-old poodle. This poodle is a breed of a dog. Developed ringworm lesions after being moved to a new home. Note this point now. When the animals sometimes when they move to new homes, like sometimes the people who are employees, which are the state governments and interstate state governments, like IS people, like IPS people, when they are transferred from one state to another state. So their animals, they feel when they move to a new home, they feel sometimes depressed, and they feel something, they have some grief underlying the condition, and they develop that skin conditions, skin problems. So over here, the skins were dry, flaky, and spread rapidly across the dog's back with increased itching in the sun. The dog seemed emotionally withdrawn after the move. Note this point now. The dog seemed emotionally withdrawn after the move, showing less interest in interaction. So natromure 30 was prescribed, and within 2 weeks, itching reduced and the lesions began to shrink. Over 6 months, the skin completely cleared and the dog returned to normal behavior. So this is, friends, this is how these remedies work wonders in animals, provided we know how to use them, provided we know how to what is their constitution, what is their modality, what is their this location, etiology, modality, and concomitants. So these are the some of the, again, the constitutional long-term approach. Tuberculin is also there, Silicea is also there, Calcarea is also there. So we have to use them according to the situation. So these remedies, they help to strengthen the immune system. That is a very, very important point. If you say we are not using any chemicals, we are stimulating the body's immune system only. So we are stimulating the energy level of the animal. Okay, we are improving the vitals of the animal, living organism. So this is the beauty of the homeopathy. that it acts by like this. Okay, it stimulates the main organs and immune system, and ultimately the overall health of the animals improved, and reducing the chance of future skin infections. So these are some of the management tips for the owners. They have to maintain hygiene, they have to maintain diet, they have to provide humidity, they have to maintain stress reduction. Well, stress in this is very very important. The owners, they have to improve this situation like stress reduction. Emotionally, stress can weaken the immune system. Very very important thing. If in the large scale in the globe, what is going on nowadays? Nobody is caring for our immune system. Everybody is giving the chemicals and medicines, and we are using the overuse of these antibiotics, and these are causing problems and problems. And we are particularly the skin conditions like human beings, in animals also, we are suppressing them. Suppression is no way to improve the situation of the skin. So these are how things we are going on, and we have to improve these situations. And every time when we take the case, we have to take the this emotional effects of the mind symptoms into account also. So other skin infections, they are bacterial, parasitic, and viral infections. So Hepersulf is again a very good medicine for suppurative skin infections such as abscesses, where the pus is offensive and there is extreme sensitivity to touch. Hepersulf is indicated when the animal seems irritable and hypersensitive to cold. So again, constitutional profile of the Hepersulf, they are often chilly, irritable, and prone to infections of the skin and respiratory system. Modalities, they are worse from cold and drafts, bad from warm. Skin symptoms, they are abscesses, boils, or ulcers. So the again one of the case, that is a 7-year-old Labrador retriever with a history of recurrent bacterial skin infections, developed multiple abscesses on its back and neck. The abscesses were painful, oozing thick, offensive, smelling pus. The dog was irritable and extremely sensitive to touch in the affected areas. And after administering Hepersulf 30C, the pus drained within a week and the abscess began to heal. So this is the beauty of the homeopathy, how it works wonders. So over the next month, the infection subsided and the dog showed no reoccurrence of the abscesses. So this is how there are other medicines also like Silesia, like this, then. So these are the examples. So I think there's no big time. So I will show you the real time cases also. So these are some of the again some of the medicines which we are using. Merksol is also there. That is very very good medicine for treating skin infections when there is suppuration, especially when the discharge is foul smelling, and there is accompanying salivation or bad breath. So mercurius is particularly indicated in cases where the infection spreads rapidly and there are signs of systemic involvement. So constitutional profile of the mercurius is often restlessness with a tendency to sweat. They may have a history of frequent infections with swollen glands. Note this point. So modalities, they are worse from night, heat, and damp conditions, better from cold applications and rest. So these are the skin conditions, ulcers, abscesses, or pustules with foul-smelling discharges. So this is a case example of a birth soul, a 3-year-old Persian cat with a skin infection on its tail, developed multiple pustules that began to ulcerate. The infection spreads quickly and the discharges are foul smelling. The cat showed signs of lethargy, bad breath, and excessive salivation. Merck was administered. Over the course of 2 weeks, the pustules began to dry up and the foul odor disappeared. After 6 weeks, the ulcers healed completely and the cat's energy levels returned to normal. Then arsenic alb, you know very well, these are good medicines. Uh, then management tips for the owners. Then we have some again common skin conditions, the atopic dermatitis. That is very very long topic. If you say we need more and more time to discuss about the atopic dermatitis and filia allergy dermatitis. Again, very very good topic. So these are the some tick infestations in animals which we have covered. And ultimately, what is this homeopathy is doing? It improves the immune system of the animal. So when the immune system is improved, this means skin is improved, and this ticks and fleas, they are automatically come down. If the skin is not good, if this immune system is down, all these ticks are there. But if the skin is healthy, there will be no tick at all. So again, so ringworm is also there. So there are a lot of pyoderma is also there. We have treated with homeopathy and like that. Then seborrheic dermatitis is also there. We have treated with, again, there are so many cases we treated with hipposulf and graphites. So every time, whenever there is problems, we have to take all the totality of the symptoms into account, and we have to find this uh, portrait of the remedy, and then we can apply, and we find the simillimum, and then we can give the medicine. Dematocosis also we have treated with this homeopathy. So these are all the case examples. Sometime again we have to find a good time. So this is again a contact or allergic dermatitis. So these are the some of the cases which we have treated successfully with homeopathy. And in the coming slides, we'll give you some case examples also. So again, food allergies is also there. Some chronic skin conditions are there. So again, scabies, that is most problem in the field conditions. So it is spreads like anything. So it cause a problem to the human health also. So that's why it is very important disease. So so we have taken up the projects in the French part for the Punjab with the help of Lions Club International to treat scabies in stray dogs. This is the root cause of the spreading scabies to human beings. So we have given uh, sulfur 1 m and acid flow 1 m weekly and alternately. Every time we go to the this uh, to a city where we call the dogs and we put the medicine in the bowls. Okay, and we give the medicine to all the dogs. We call the dogs over there, stray dogs over there, and we give them medicine. 1 week we give sulfur 1 m, and next week we will give them acid flow 1 m. And if we give these medicines alternately for 5 to 6 weeks, ultimately this scabies has gone. So in the you can see from these pictures over here. So this is the before treatment. These are scabies dogs are there. So we have taken these cases on a large scale, and ultimately, and this is the before treatment, this is the during treatment, and this is after treatment. Only with these two medicines. So we can help the society also. So by treating this, we have prevented the people from this problem of the scabies. Okay, so this is how we are helping socially the people also. So the homeopathy is very effective, as you know. Otherwise, these dogs have been never treated, and they have been treated with some of the antibiotics, and they are so costly. And over here, we have given medicines only for, you can say, only for 10 rupees each animal, not more than that. And we have treated so many about 300 to 400 dogs of one city. So this is how the things we can proceed forward. So this is again one of the studies on, I have this is a case which we have, this is a poodle case, a 3-month-old poodle pup. You see the face over here, it develops some skin lesions over there. So we have taken this case, and this is a poodle case presented to my clinic. So alopecia on the face is there. This is a moist skin lesion with alopecia on the lateral side. So we have reported the case, we have taken the history, and we have done the laboratory examination. So then we have done the roll swab examination. So we have find the mites over there. That is demodectic mites are there. That is under 10x power. We have seen these things. Then we have done roll swab exam also. So to find the organisms on the cytological examination of a otic discharge. And this is are the deep skin scrapings. More than 5 live demotactic mites are there. So you can find these demotactic mites are there. These are demotactic mites. So hair plugs rapidly readily relieved demotactic mites. Whenever we have to find, we have to pull the ear, pull the hair of the animal, and they are lying underneath of that. So this is how we find by examination. And this is again a dermatological exam we have done. Glass slide, impression smears, moist relations with cocky. Then this is a diagnosis we made: otitis externa, demodex, otodactylis, cyanotis, and meninges reasons are there. So the papa also recurrent pyoderma also problem with the generalized dermatosis. So we take these symptoms in sedation: head shaking, moderate pruritus, ear scratching. Earlier the dog were treated with pyoderma, slight yellows, otic discharge from both the ears, and we have reportized the case over here. You know, these are the medicines which have come up, that is Sorinum, Ambrogracia, and Pyrogenium. And by this, we have taken all the conditions. And over here, we have given Sorinum, 30C, 3 doses after every 5 minutes on a 0 day. Then Mulin oil ear drops in BID. Calendar lotion 1 to 20 was advised for bathing. Coconut oil was advised for external application with this calendula lotion with the 1:10 ratio, 1:9 ratio with the calendula for the external application. So we have given Sorinum. So this is how we have given Sorinum, how this prepared. As you know very well, everybody knows very well how this Sorinum is prepared. So this is Sorinum, how it is principal indications. They are associated with the, we have read all these symptoms also. So over here we have given this one, and ultimately after 7 days, by taking more symptoms into account, we have given Sorinum 200C 3 doses after every 15 minutes. So we have given Mulin also, calendula lotion. So this is the results monitored at regular intervals. So democratic means autodactic main fights, which are very positive on the 0 day. On the 7th day, there are only democratic mites are there, and on the 21st day, only demodactic mites are there. So this is on the 0 day they are more than 5. On the 7th day they are reduced to 2, and on the 21st day they are 0 to 1. So this is how these conditions improve. This is 0 day. I have shown you the first.
എനിക്കറിയാൻ വയ്യ.
If it is okay.
Okay, somebody was talking. I just closed.
Okay. Thank you, sir. So if it is good going on, sir, I can continue.
Yes, sir. Yes, sir. You can continue, sir. It's
Okay,
a very
okay, thank you, sir. So this is the 0 day before therapy, and this is the on 14 day, and this is on 28 day, and this is on 42 day. So this is how we are working on these conditions, and you now you see the now phase also. This is your 0 day, 14 day, 28 day, and now this is 42 day. So if you say the conditions improve within 2 days or 3 days, no, it takes some time. We have to take the case every time. We have to find, sometimes we have to give medicines SOS also. So this is how the otitis externa was reduced on 21 days. On the 28th day, no dermatitis bites were there. So only it took 42 days for complete clinical recovery from generalized dermatosis. So this is very tough condition in animals. So whenever we use these conditions in treat these conditions in clinics, they are very expensive. They're not simply, but with homeopathy, yes, very economical. Homeopathy, you can say, it is very economical, and it suits also because it has no side effects. And nowadays there is a lot of people. This is one class you developed in the society. You can say they are saying, "Okay, we will use homeopathy only. We are not going for any conventional system medicine. We are going to use only homeopathy because we are showing them results. We are doing work." So we have to show our this uh, papers, and you have to write our papers. Like I have so many papers. They are published in international journals, like International Journal of High Delusions, like that, like that. So I have attended all the conferences, LMHI. Then I am the life member of IAVH, that is International Association of Veterinary Homeopathy. So that is how we are proceeding forward with all these things. So these are some of the papers which have been published. So again, one case, more case. So this is a 6-year-old male dog, Bruce Bull Terrier mixed breed. Then there is a history of ear scratching. So we have listened this case, and we have taken these all the history into account and from the owner, and we have found these mites under the microscope. Like these are the mites which are under the microscope, these ones. Okay, so then again we have taken all these symptoms into account. Intense itching of the anus, and in sports, worse warm, particularly in the morning time. Moist presence with alopecia on the face and both lateral side of the body. Profuse, sore, offensive perspiration. Note this point. The nails are crippled, break easily, brittle. Very good point over here. Well, this is the beauty of the homeopathy. It takes into account everything. Now, with the is not taking only the skin symptoms into account. It is also taking these nails also into account. The nails are crippled, break easily, brittle. Prefer to sit in a corner, calm and quiet all the day. Again, a mind symptom. Associated complaints is chronic constipation with piles. Now we are taking now totality of these symptoms. We are not taking only one condition, that is intense itching. When the owner of the animal comes to us, he will tell only these things. Intense itching. Then we have to find. Then we have to find by asking history. Where is the intense itching? He says it is anus. Then in sports, then how it modalities first from warmth, particularly in the morning time. You see over here, we have asked the owner of the patient when this itching is more intense itching, morning, evening, during day, during night. So every time when we ask these questions, he will really deliberate everything. And homeopathy matters on time also. If it is in the night, if there is intense itching in the night, medicine is separate. If it is during the daytime, it is separate. And if it is in the morning time, it is separate. Okay. So we have taken into account these things also. Profuse, sore, offensive perspiration. We have taken into nails into account. We have taken to mind symptom into account, like prefer to sit in the corner. So we have taken the chronic constipation with piles into account. So this is the beauty of the homeopathy. We take totality of the symptoms into account. And after taking the totality of these symptoms, we reprotize the case. Okay. And when we reprotize the case, we have taken over 10 symptoms over here, and the ultimate medicine is fluoric acid. Acid floor, you can say like that. So this is the first question by taking all symptoms into account. So our first question was acid floor 30. Thrice a day for 7 days. We have again given calendula 1 into 20 was advised for bathing. And for external applications, we used 1 into 9 parts with the coconut oil. This is the common practice we are doing in the field conditions. So this is the one when we have followed up this, stools better, no more constipation, no further increase of the patch, started feeling bit itchy over the spot. Acid floor again we have given for 7 days. You see over here, the things are improving now. Much better in journal, started getting hairs on the spot, again constipated, hairs coming regularly, patch almost disappearing. So again, we have increased this potency of the medicine, that is acid floor 1 m. We have given 1 dose only now. And now you can see this follow-up on the 27th June. Okay, this is completely cured now. Okay, so this is the first condition you see over here, this one. Okay, and this is the over here condition. So this is how homeopathy works wonders. So conclusion is, by maintaining proper cleanliness, Isolation of the affected fats, giving good nutrition, even cooked or plain steamed fish is better. Best for recovering, contains omega fatty acid, sulfur extra with the skin needs, and selecting a suitable home remedy. Scabies can be treated very, very effectively. So this is, friends. Thank you, sir. I think we have finished. So this is my nowadays where I'm pursuing my artificial. I'm doing pursuing this advanced certificate in artificial intelligence in digital health and imaging. So nowadays, I will in the future terms, I'm going to integrate this artificial intelligence in homeopathy. We will scale which potency is going to be better and better. And in one of the papers that is selected in the GIRI, that is Giri, that is the conference is going to be held in Slovenia, and my paper on this AI role of AI and ML in detecting epileptic seizures was selected over there. So that will be going to be published in International Journal of High Delusions also. So this is my institution. This is my some of the where I'm the chief guest, and these are some of my people. These are all vets. We are in LMHI. We are all over Indian. These people. Some are from Brazil. Some are from this other countries, old countries. So this is last time we are in Istanbul. We have a conference over there, and these are all the vets. They have given their presentations over there. So this is again people from all over the world. So this is again we have conference in Goa, and this is my book, and this is my software. So this is again everything about artificial intelligence. So thank you, dear. Thank you so much. You. Now we take some questions,
Yes.
if you like.
Yes. It's really a very good session indeed, sir. You
Thank you, sir.
really thrilled us with the power of the knowledge in homeopathy. As a homeopath, we are proud of being a veterinary, being a veterinarian. Still, you are
Yeah.
following the rules of homeopathy, and you are you are able to find the constitutional medicine in a good way also. And
Yes.
that
Yeah.
the
Yeah.
success, the classical, typical classical homeopathy is
Yes.
being.
Sir, we are the follower of only classical homeopathy,
Yes,
and we are every time we take the constitution of the animal. That
yes,
is very, very good. If we find the constitution of the animal, we are going to get 100% results with homeopathy without
yes,
any problem.
yes. Even the mind symptoms are
Yes.
also
Yes.
we
Yeah. Yeah.
all those mind symptoms in a better way than anybody else. That's the success of the of your success of your practice, and
Yes,
definitely
sir.
this will be a big boost for homeopathy all over the world also, because you are simply not simply treating the patients, but you just keeping all the records with you, and then publishing it in international journals, and thereby more and more people are able to understood what is happening with homeopathy in veterinary science also.
Yes, sir.
So, we are really proud of you.
Thank you, sir. So that's good. Thank you.
I invite Dr. Rampari sir to say anything, if any.
Thank you, Dr. Dhaneji, and good evening, everyone. और congratulations, हमारे डॉक्टर सुजीत सिंह माकर सर. Very
Thank you, sir.
nice session. हाँ,
Thank you, sir.
excellent session.
Thank you.
Veterinary treatment
Thank you, sir.
easily diagnose the homeopathic medicine. Veterinary and the constitutional medicine. Uh, excellent session. But homeopathic medicine, mathematical role of mathematical medicine and objective symptom, treat the medicine, homeopathic medicine, and dermatitis is the very many kinds of medicine is the full medicine for veterinary treatment. So very thanks and ringworm, etc. Good advice and good veterinary treatment and
Thank you.
dynamic lecture. Thank you, sir. Very,
Thank
very
you, sir.
thanks.
Thank you, sir. Thank you. Thank you, sir. Thank you.
Dr. Surjit Singh, what is the present situation in Punjab with the veterinary doctors? How many of them are practicing homeopathy for this kind of diseases?
Lot of people they are practicing. We are started a new course in veterinary homeopathy also, that is postgraduate certificate course in homeopathy, veterinary homeopathy, and we have 89 students over here, and all are vets. Basic qualification over here is veterinary BBSc and AH, that is minimum qualification, and after that this is 1 year course, and we are our people are adopting it very
Uh, what about the support you get from homeopathic doctors there?
yeah. We have a lot of doctors over there which are helping us, like Dr. Muktinder Singh is there, Dr. Praveen is there. There are a lot of doctors which are faculty of ours, and we have international faculty also. We have Dr. Sidley she's from Brazil, and we have Dr. Banu, she's from Istanbul, Turkey, and one we have Dr. Bizam, she's from Slovenia. So these are the international faculty which we have with us.
Okay. What kind of respect you got during the presentation?
Yes, yeah, it is very good. Yeah, people
Elements.
now people are following us. As I already told you, then now there are a lot of people which have developed this thing in their mind that they are going to get the treatment with the homeopathy only. So there's a one class that is fully developed in India, you can say, like in our Punjab and other states also.
Have you ever
Because
visited?
I'm actually I'm a freelancer in the whole world. I have no clinic with me, but I'm advising everywhere in the world.
Have you ever been to Kerala?
Yeah. I was also the faculty member over there in Kerala.
Okay.
The course we have started in the Kerala. First of all, we have started that course.
Yes, sir. Yes, sir.
We are the pioneer in that. I was teaching veterinary respiratory at that time.
Exactly. Kerala was
Kerala Veterinary University is the only first university which have started this course. And we are the pioneer people who have started this course.
That's why. I asked such a question. Because
Dr. Bidu Jain is there. He is our course director at that time.
okay. Then we have Dr. Mustafa, you may be knowing.
Yeah, he's my colleague also.
Yes.
I know him very well.
Yes, very.
He's very near and dear to me.
Definitely, we need some more presentations from
Yes.
you so that we can promote homeopathy among public also with these presentations.
Yeah, most welcome, no problem.
Yes. Anyway, congratulations and thank you on behalf of International Forum for Promoting Homeopathy, as well as those who presented in this forum. And
thank you, sir. So nice, sir. Thank you.
Thank you.
Highly blessed, sir. Thank you, sir.
Thank you. Very nice. Okay.
Thank you,
sir.
participants too.
Okay.
Tomorrow we will have a session from Dr. Richa Thakur. She will be presenting a case tomorrow. With that, thank you once again, Dr. Surjit Makkar.
Thank you, sir. So nice. Thank you, sir. Okay.
With that, we come to the end of the day 1503. It's the time to begin our Malayalam session. Over to Dr. Maria Major.